Yeah, we have 45 registered.
Yeah, okay. Well, as I said, they'll come in or they'll look at it later. Okay, so just want to introduce, so tonight's our last night of our resident wellness series. This program is being recorded, and you can find the other episodes online. They'll be on the PBCMS website under wellness. I just want to congratulate all the residents as they're transitioning now into becoming attendings. Now, wellness, of course, is very important that you find a position or place that fits your personality. And so tonight we have pretty much every spectrum that you can think of in terms of practice models. And so we're going to introduce everybody, but we'll start with Chase Howard, who's an attorney, and he works with various business models. And attorneys are very important, you'll find, as you get out there, because they help us negotiate the waters. And as you know, medicine is a blood sport. We also have Dr. Martha Rodriguez here, who is in private practice. She has a very successful private practice. And those of you who think that you have to only become employed, just to let you know, you don't. We have Dr. Michael Blum, who is a GI physician, who was in private practice for many years and now works locum tenens, and he'll talk about those. And Dr. Robert Colton, he was also in private practice, and he actually started the Concierge movement in this country, and as one of the founders of MDVIP, a very prestigious organization, and we're glad to have him here as well. And also Dr. Claudia Mason. She's has a recorded video, which you'll see, and she was in private practice as well, has been employed with the Cleveland Clinic for the last 13 years and is a OBGYN. So Mr. Howard, if you could please take it from there.
Sure, thank you. So my name is Chase Howard. I'm a healthcare attorney based in Delray Beach. I'm with the Florida Healthcare Law Firm. When I say I'm a healthcare attorney, that means could mean a lot of different things to a lot of different people. So what I focus on is transactional and regulatory compliance for healthcare professionals and healthcare businesses. And to break that down even further, I work with people like you who are starting practices, leaving practices, opening up new healthcare businesses, navigating the regulatory minefield that is in Florida and on a federal level. And also helping you ensure that you understand, corporate compliance, setting up a practice, signing a contract, getting out of a contract, or going into business, opening up concierge practices, et cetera. So I work with a lot of different types of people, business people, healthcare professionals, physicians, nurses, nurse practitioners. And really at the core of what I enjoy doing is working with residents who are about to take their first steps out of residency and into the real world, right? And there's sometimes a lack of exposure or knowledge or education on all the different routes you can take, and you're lucky to have a group like this who's going to tell you about it and who has taken those paths and have trailblazed those paths. But still, there's some guidance along the way that most people need. So that's where I step in. I want to help healthcare professionals. I come from a background of all my brothers, my dad, my uncles, all in healthcare, physicians, et cetera. So I'll go through a couple of the different practice models, and then I think you'll hear quite a bit more from the respective practitioners and business owners here. So first, the traditional route is to graduate and go out and get employed. Every type of model is fit for somebody. It's different. It's got different pros and cons. It really depends on the type of person. As an employed physician, I think one of the big things you have to really consider is, how much control you want over, your schedule, the business, the practice. Do you want to just go in and practice medicine, or do you want to actually get into the business of medicine? And I think there's certainly some overlap there, and you've got to be aware of that if you want to go into private practice. So going into an employment situation, there's a lot of things to consider. Reviewing your contract first and foremost is probably the most important thing you can do, not just on your own, not just hire an attorney, but you can speak with parents, relatives, mentors, somebody else to put other eyes on it and really advise you as to what you're signing. Because once you get into it, you may think you're just practicing medicine, but you're entering into somebody else's business as well. And to see how you fit there, to make sure that you're a long-term fit there, and maybe there's a place for you long-term as far as partnership or ownership after, is really important. And signing that first contract, typically they're going to be 3 years long. That's a real serious investment when you're first starting, to make sure that you get it right. And I think you want to get it right because you put so much time and effort into school, and you're coming out with potentially significant amounts of debt. So making sure that first contract is really reasonable. Doesn't have to be all in your favor, but something that you can live with, something that fits you, is really important. And you can always negotiate, I think, the big terms, but you want to look at all the little boilerplate information in there too, because lawyers like to just write words, and sometimes they don't make any sense to anybody else, including other lawyers. So really making sure you understand what's in there is super important. The next model is you want to go out and kind of start your own practice, private practice, traditional healthcare practice. And Dr. Rodriguez, I believe, will be talking about that soon, and she'll tell you more about the joys of it. But I think that's fit for a different type of person. That's for somebody who is a little bit more entrepreneurial and wants to really build their own practice, control what they do. But you've got to also consider that you might have employees, you might have other practitioners. At some point, you may take on partners. And there's a lot that goes into that. Structuring properly. Are you going to choose an LLC or a PA? How are you going to deal with partners at some point? How are you going to deal with buy-ins and buyouts? How are you going to deal with employees? Because you're really not just practicing medicine. You're now a business person, a business owner, in addition to practicing medicine. And you've got to really navigate the waters, not only healthcare regulations and insurance regulations and payer issues, but employment law. You've got to deal with patients that may slip and fall and might not even be related to healthcare. So considering those things, it's really, it takes a special person to jump right into that. A lot of people are successful starting off as an employee and learning the ropes, being in a private practice, and then going into the route of starting their own practice, and they do really great things. So quite a bit to consider there. As far as the locums model, locums, I've seen really great things with that, and you can, I think, utilize it in maybe two different ways. One is in addition to maybe an employment role, if you're allowed to. If you've got extra time off, free weekends, and you're willing to maybe travel, then you can certainly supplement and even close to double your income, obviously, for giving up some more time and travel at the same time, expenses paid, and you get to experience different, whether it's ERs or locations around the country, work with different people, learn from different people. I think it's a great opportunity, and I've seen some young physicians even start out and really just build a career around locums. Dr. Blum, I know that's your primary method of practice now, and whether it's at the beginning or the later end of your career after you practice in a different setting, I think you could do really great things with it. With locums, though, you're going to be contracted typically with either a staffing agency or another group that's going to place you. You'll probably, hopefully, have some good control over where you're going, what you're getting paid. But there may be times where you're still considered an employee, or if you can negotiate it to work as a 1099. And I think there's benefits to both. If you can take advantage of having your own corporation and expensing your own travel and things like that, you'll have a little bit more freedom and ability to work with different groups and bounce around. Dr. Blum will talk quite a bit more about that. But I think it's a really great thing. And I've seen, like I said, some young physicians who are graduating and they kind of build a career just around this. They don't have a primary practice, and financially actually even end up doing better. Granted, they're traveling more and moving around more, but they build a nice career that way as well. Lastly, private practice. Well, we talked about private practice. Concierge practice, sorry. Concierge practice, if you're kind of in the the field of, I want to own my own practice, but I don't want to deal with maybe the headaches of insurance and the regulations that come with that. There's certainly a market for an opportunity for a concierge practice, a VIP practice, if you will, right? And in those structures, patients are typically paying a fee to have greater access to you as the physician. With that also comes maybe the downside of you have to be available for them, and they may not want to see somebody else. So you're maybe limiting how many people can come into the plan and to your practice. Maybe they're paying a higher fee, but they're paying you potentially up front, or at least on a really regular basis. And you don't have to deal with clawbacks from insurance and dealing with coding and billing. But you do have to consider what that means as a solo practitioner that has VIP access to you. Does it mean weekends? Does it mean house calls? Does it mean when you go on vacation, patients may be upset because you're not there and they've got to see somebody else? So how do you maintain and retain those patients? Dr. Colton, I think, will dive quite a bit more into that and give you some good insight. But it's certainly becoming a much more popular practice, the concierge VIP style of practice, as physicians transition away from or out of insurance, as people want, I think, greater, more attention to them in their healthcare space. So something to consider as well. And then lastly, group practices, it kind of in the same mold of being employed, but maybe this is a greater opportunity for a hybrid between ownership and being, self-employed and employment. Group practices that are looking to grow, that are hiring on, new young physicians will typically have some sort of partnership track or opportunity for you. When looking at contracts to join a group practice, it's really important to understand how, collections and overhead are split and shared, what the partnership route, may or may not be, if there's any sort of promises or guarantees that that's going to even occur, and also what the restrictions are afterwards. At some point, if it doesn't work out, you may be restricted, and this may be a large group practice that controls all of Northeast Florida, right? And what's that mean for you and your family if this position doesn't work out? Well, you might be pushed, 90 miles away from every single office, and that could be significant, consideration if things don't work out. On the flip side, it kind of gives you the best, I think, combination of ownership and employment. There's a group of doctors that have kind of set things up before you started it up, but maybe you're going to get your own practice area or location. And share some of the overhead, but not, have all of the headache of just being, managing employees and dealing with insurance on your own. You get to share a lot of that risk. So a lot of really great options out there. I'll be around after for some questions, but you're going to get a lot of great information here from the next few presenters. I think really a great opportunity to learn. I know as a young lawyer, I always hope to have great mentorship and to see people before, that have done this before me and have laid out paths and actually share that information with me. So you're going to get that, enjoy it. Thanks for having me here, and I'll look forward to any questions afterwards.
Okay, so we'll get started then with Dr. Rodriguez. So if you could go ahead and unmute yourself.
Hi, good evening, everyone. So I'm going to talk about private practice and about anything about private practice or any practice. In my view, there's one word to describe it, and it's prevention. So before I dig into my slides, I'd like to talk about two things. The first one is the most important one I'm going to talk about. We have to get vaccinated. We have to tell everyone to get vaccinated. Please, 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 we have to get out of this. There won't be any healthcare for anyone unless we get out of this epidemic. And secondly, the biggest epidemic that has been not in 2020, but going on for so long, we're having an amazing series of events coming up about the opioid epidemic. Please register and attend those events. This is very important. Don't take it for granted. Unless we eliminate these pandemics, we are not going to be able to progress in any setting. Okay. So then I'll jump into my slides. So the title of my talk is luck is the intersection of preparation and opportunity, and that is because none of us went into medical school and learned anything from day one. So it is very important that you understand that medicine is a gift. It's a gift, and no matter what you choose, you have to make sure that you choose the right thing for you. You never want to go into something without really knowing. Like, you didn't go into anatomy and take the first test without really knowing what was part of the test. So one of the biggest parts of private practice, I would think, is leadership. Leadership is a very important skill, and it's very important to acquire from day one. You didn't learn to run a code because you weren't autonomous enough to do so. But you have to understand when you go out in the world and in business, you also have to be able to spread that leadership ability to fill the gaps that you don't have. So learn from day one leadership skills. Let's see. One of the other things that is very important nowadays, and actually very, very dynamic, is technology. Don't underestimate the power of technology. Technology is ruling medicine. It will rule medicine forever, and it's the number one cause of burnout in medicine. EHRs have caused us to click to burnout and to lead us to fail. Don't let it happen to you. If you decide to even consider going into private practice, try to learn as much as you can about any EHR that you see out there and become familiar with any of them. My biggest concern about talking about private practice is that private practice as we knew it in the past is not going to happen again. We cannot get paid by seeing one patient and ordering one test and bringing the patient back. You have to learn about value-based care. You have to learn about EHRs. You have to learn about quality measures. You have to learn about the things that will create a future for you. So my biggest advices are: learn what you can in residency. Try to get as familiar as you can with technology. Try to shadow people that you admire and people that are similar to you and people that you want to imitate. And one of my biggest advice, no matter what setting you're going into, make sure that you feel comfortable about what you're thinking about doing. You cannot think about going into private practice and not be familiar with a doctor that you admire. Shadow them and come to the community, visit the community, get familiar with the area where you're going to live. Make sure that this is going to be for you. Don't ever think that you can walk into an office nowadays and say, this is going to be my office. That's not going to happen. Private practice like that is not going to happen. So use residency as a rehearsal to prepare you for that and make sure that that is what you want to do. I think it's great. I think it's an amazing thing that 2 weeks ago, I had an employee that her mother died and in another country, and she didn't have money to go and take the trip, and I gave her the money to take the trip. That freedom is unique, and private practice allows you not to be in a corporate environment to make decisions like that. But that comes with a lot of responsibility and knowledge. So please, please, please use residency as a rehearsal from day one. Make sure that you follow, like Dr. Baca, somebody who has a lot of experience, who has been there, done that. One thing that I would say, and honestly, is the biggest knowledge that I have acquired in the last few years: join your medical society. These are guys and girls who are dedicated their time to mentor and teach other people what they've gone through. If I had to do it all over again, I wouldn't do one day in medical school or residency without joining my local societies. You can pick up the phone and call one of these guys and girls, and they will walk you through anything that you would have to walk through by yourself. If I can tell you anything from today, there's two things. Please learn from day one that you cannot do this by yourself. You didn't pass anatomy because you opened a book and you got an A on the grade. Number two, make sure that you associate yourself with people that you want to be like in the communities you want to live. And the most important advice I have is please make sure to join the local societies and the people that are there for you and that will back you up and help you through it. Okay? Make sure that you learn all the EMRs that you can. Be aggressive. Go to the different offices. If one has ECW, go to ECW. One has Athena, go to Athena. Go to all of them. Make sure that you get involved with the EHR. Make sure that you get involved with the developers. Make sure that you're at the table when they're discussing how to develop what you need. Do not be a passive EHR user or you will be burned out by clicks. Dr. Baca, do you agree with that or not? Yeah, so one thing I do, I use ECW, and I didn't want to mention any companies, but ECW doesn't develop anything in their company before they try it in my office. Because if it's going to burn me out, I don't want it. Okay, so make sure that from day one you get familiar with all of that. Another thing that is very important, and it happened to me because I came to this country when I started high school. So when I started medical school, I struggled very much because I was very poor. And when I started residency, I started making $62,000, and I thought I was the richest woman in the world, and spent $196,000. Don't ever make that mistake, okay? Most of you are getting out of school with a lot of debt. From day one, make sure that you save every penny that you can, because a cushion of financial cushion will get you through anything. It doesn't matter what pandemic, it doesn't matter what crisis. So from day one, make sure that you save every cent that you can. And remember, no matter what, we are here to serve you and help you. Reach out, learn from anybody you can, ask any question you can. No question is a bad question. Just get involved and be aggressive. No matter what, no matter where we are, this is such a privilege. This is such a gift what we do. Whether you want to do it on your own, whether you want to be an employee, whether you want to be a concierge, it doesn't matter. The world is different because you exist. So take that very seriously and make a difference every day.
Okay, well, thank you, Dr. Rodriguez. So I believe we have Dr. Mason's section. So Mindy, if you can cue that up.
Sorry, I'm having a little bit of difficulty. Hold on one second. It's not letting me share my screen for some reason. There we go.
Mindy, the audio is poor.
It's all the way up.
Maybe in the interest of time, Mindy, while you figure that out, we can go to the next one so we don't waste time. So you don't have to be stressed also.
Do that.
Correct. So would you like to go next, Mike?
Sure. First, thanks for having me. And I want to talk a little bit about locum tenens. Just as a brief background, I started in a group practice in 1988 for about 3 years, further north of where I am now. It was a multi-specialty group, and at the time, things weren't quite going as well as I had expected, and ended up meeting my wife-to-be and relocated here to Delray Beach and started my practice about 33 years ago here. And over the years, took on 3 younger partners, 2 nurse practitioners, got involved with a building, land, an ASC, and everything was running gangbusters and everything was great. And then about 4 years ago, we were approached by a much larger group that was in the practice of acquiring groups like ours and was backed by private equity. And after lots of negotiations, we were acquired by a much larger group and things were going along great as well. However, that had some downsides and there are pros and cons to everything, of course. But at that point in time, a couple of years ago, I decided, well, I think I had enough and maybe time to move on. And I had given notice and basically had to leave, but wasn't quite ready to stop practicing medicine, especially GI. I felt I had a lot to offer. I'm still pretty young physically as well as intellectually, and thought, geez, maybe there's something else that I could do to keep my mind occupied and be able to try to give back somewhere. So I started looking into a couple of other opportunities, and I heard about locum tenens. And I didn't know anything about it at all. And basically did a little research and started with some of the basic stuff. So just for everybody's education, especially the residents that are out here, well, what is locum tenens? And basically the definition is, at least related to medicine, a locum tenens physician is a physician who basically is contracted to work on a temporary basis to fill in for either a vacancy, a vacation, or an extended leave of another physician. And that's kind of how it got started, probably about 20 years ago. And as the years have gone on, there has actually been a huge, absolutely huge need for locum tenens physicians for several reasons. One is that in general, more and more physicians are now employed or become employees of either a hospital setting, a group setting, an HMO setting. And as a result of being employees, there's a lot more turnover. And as a result of the turnover, there's a much bigger need for temporary physicians to fill in for those people who are leaving those circumstances for whatever the reasons are. Secondly, there's a huge growing shortage of physicians nationwide due to the increased need, perhaps less people coming out of training or going into certain specialties where there is not as great as need. And there's really no way to replace those physicians on a quick basis. People are retiring earlier, people are deciding to go into different professions for whatever the reason, and there's just no way to replace these physicians on a quick basis that are really needed in a short notice. And locum tenens is one way to provide that. And the third major reason is that, especially with Veterans Affairs benefits, there is a huge need now, and there has been, because locums fill in a lot in the VA hospitals, as well as the Native American and Indian health services, which are predominantly in the Southwest and those areas, but in the North Central Plains. So there's a huge need for people to work in these areas, which may not be the ideal setting from a utopian perspective, but there certainly is a huge need for coverage in almost every specialty that's out there to fill in a lot of these areas. So as a result, locum tenens has gained in popularity as well as in its ability to provide services where people may not want to go, but where there certainly is a huge need for it. Okay, so at this point in time, well, who does locum tenens? And there are basically 4 different areas from a career standpoint for locum tenens. One, at least in this circumstance, are people who are newly graduated residents coming out of training. And in those circumstances, in a lot of those circumstances, the resident's spouse may be finishing their residency, so they're not as mobile yet as they want to be. Or the spouse potentially could be in the military, and they're not as easily able to travel or to relocate so quickly because they have an obligation due to the military. But obviously, these are people, residents that may want to check out geographic locations and practice opportunities, but not quite commit to a contract or a long-term position without kind of feeling their oats and seeing different areas and practice models and that sort of thing. So as a result, for residents or people coming out of training, this is one possible resource or way to kind of get your feet wet, kind of see what's out there. The second group would be retired or soon to be retired physicians who may want to be near family, may want to work less, certainly not full time, may want to work part time, perhaps a week a month or every other week or something like that. So it's a way to transition out of full time practice or pseudo retirement, which is kind of what my circumstances are or have been. Thirdly, a mid-career physician, somebody who may be in their 40s or 50s and may have another 15 or 20 years to go in practicing medicine, and they may want to supplement their income, perhaps work less, perhaps have a lighter workload, less call, less weekends, less holidays or no holidays, or they may just be dissatisfied being a physician with the current climate, with litigation and medical malpractice, the insurance companies taking over, all the things that we all hear about, but they may be dissatisfied and say, you know, maybe I'll cut back or I'll switch to working some temporary or part-time work and doing some locums work here and there. And it gives them a way to maintain some pretty good income while they decide what their final decisions are going to be in their career. And fourth, there are full-time locums, which is what Chase had mentioned briefly a little while ago, where people may come out of residency and say, you know, this is something that I get to travel. I get to see different practice models, different areas around the country. If their spouse wants to come with them, or if they're single, now that's a great time to consider doing it, where you can travel around, make excellent money, depending upon what your subspecialty is, of course. And then it's a way to transition and help out practices that may be having disruptions, either due to employee attrition or illness, or somebody, for example, that may be out of maternity leave or whatever the circumstances are. And it's considered like a locums lifesaver, where some people just do full-time locums and they're contracted with numerous agencies and they're notified, hey, on short notice, can you help us out? Somebody's leaving, somebody unfortunately had surgery or became ill, and they need somebody to replace them for whatever that period of time is. And you could do that and go from place to place to place. So there are different circumstances depending upon your career and where you are in your medical career after residency. But as I kind of call them the 3 F's of locum tenens. One, flexibility. Secondly is freedom. And third is financial. By far and away, the biggest reason for people going to locums is flexibility. And having been in private practice for many, many years and seen how things are done, certainly being in private practice is relatively inflexible. If you're by yourself, then you know what the responsibilities are. If you have partners, well, you know that you need coverage. You may be on one night a week for your group, or you may be on a weekend a month, or if you cross cover with other groups, perhaps 1 in 6 weekends or whatever. But there's a little bit more flexibility there because you have more people that are sharing the load. But if you are by yourself, that certainly is going to be somewhat less. And the nice thing about locums is that you can kind of pick and choose where you want to go, how much you want to work, what geographic location, whether or not it's outpatient clinic or is it inpatient coverage only, is it hospitalist work, is it just ER coverage? Depends upon what the circumstances. So you basically call the shots. So that's a nice position to be in, depending upon where you are in your career and where you are from a financial perspective. Okay. So the next thing would be, well, how do I find a locums job? What do I do about it? Or how do I look into it? Certainly going to the internet and typing in locums tenens is one way to do it. From a personal perspective, I was starting to look into this, and interestingly, I found there was something on Facebook, and there was a website. And I have no disclosures here, and I have no financial interest in any of this. But when I went online and through Facebook, there was a website called mdjobsite.com, mdjobsite.com. And it said, if you're interested in looking into opportunities, give us your contact information, maybe an email address or your cell phone if you'd like, where you'd like to work, what specialty, and someone will get in touch with you. figured, okay, maybe in a month I'll hear from somebody. And literally the next day, I must have gotten 20 phone calls from all around the country and probably 3 dozen emails from different agencies saying, hey, we really need GI. This is great. Please get in touch with us, whatever. And I was pretty much overwhelmed within the first week and amazed as to how many contacts I had gotten as a result of just logging into MD Job Site. And they deal with all specialties. And if you log in, you can ask more information about that from them directly. Another way is to go through an agency. And the key thing that you want to really be careful about is that there are many, many agencies out there, probably 30 or 40, but you would like them to be a member of what's called NALTO, N-A-L-T-O, which stands for the National Association of Locum Tenens Organizations. And it's an organization that basically keeps tabs on the agencies to be sure that they manage things professionally, that they have a good reputation, that they know what they're doing, that they have no legal issues involved. And there's a significant oversight on the different agencies regarding how they manage, how they place people, how they credential, the relationships that they have with different facilities. And it's a good way for them to be overseen with credibility. And there are many, many agencies around, and a lot of them are very much related to the geographic area where the agency is located, the location of the agency itself, and what providers or hospital facilities or agencies that they deal with, because they all seem to have contacts to be able to place people in different areas. And how many agencies are you going to get involved with? Some people say, well, start off with just one and see what kind of feelers you have out there. I started out with 2, and I thought about it and saying, geez, I really wasn't getting a lot of positives or a lot of contacts. So I signed up for as many as 8. And now I think I have pretty much everything covered pretty much throughout the country. And I'm getting phone calls for jobs that I just can't handle, which I don't want to do because I'm so busy as it is, but you can pretty much pick and choose where you want to go. Living in South Florida, I certainly don't want to go to Bismarck, North Dakota in the wintertime, but I've been up to Bismarck, North Dakota in the summertime, which is a very interesting place. And if you like to travel and see different areas, obviously, which is certainly something my wife and I have kind of dedicated our lives to doing internationally, but certainly in this time of COVID, we haven't been able to go anywhere. So it's certainly one way to travel domestically and see a lot of areas around the country that we probably would never have gotten to see otherwise. And it's certainly been a very, very eye-opener regarding how they practice medicine in different areas around the country, patient demographics, different socioeconomic statuses, and certainly see how hospital systems and facilities manage their patients in different areas around the country. So it's been extremely eye-opening, and you certainly pick up a lot, learn a lot, meet new physicians, and it's certainly been a very rewarding experience from my perspective. The nice thing about the agencies as well, certainly is the fact that they have numbers. They have placed hundreds of people around the country. They've got a lot of experience doing it, and they take care of pretty much everything. They locate the position. They have a relationship with the recruiter. They do your credentialing. They're a person that you can contact if you have a problem regarding getting to your destination or your assignment. And they, if there's issues with travel, if there's an issue with malpractice. And the nice thing about the locum situation is that all of these agencies, they cover all your expenses. They cover your licensing. You have to fill out a lot of the applications, which is probably the biggest pain in the neck. But once you start getting that done, it's much, much easier. They cover your licensing fees. They cover your travel and your transportation to where you're going. They cover your hotel, your rent-a-car, your medical malpractice with tail while you're there. And they will renew your state licenses. And as a result of the locums, I have 9 state licenses now, all of which they paid for from the different agencies. And they basically have you in their back burner looking for any opportunities that open up. The nice thing about locums is the fact that you basically have no overhead. I don't have an office now. I don't have to pay a staff. We opened up our own PLLC, or professional liability corporation, and you could do that however you want. Basically, you get reimbursed as a 1099 from the agency. As a result of that, of course, you have to pay your own taxes or state income tax, depending upon the state where you're working. But that's a pretty easy thing to do. And obviously, everybody's got an accountant, and they can figure that out pretty simply for the most part. But you have no overhead. So if you're in private practice or whatever, and your overhead is running anywhere from 45 to 55%, well, that basically goes into your pocket as well. And you pay your taxes, of course, but you're not paying any other overhead expenses. So that surely is a nice perk. The minuses about working with an agency, well, the agency works for their client. Are they working for us too? Yeah, they are, but basically they want to satisfy their client, whether it be a hospital or a group practice or wherever the situation is, the VA. So they're working for them. And they will tell you, yeah, we're going to get you the best rates or whatever, but you kind of find out sooner than later that everything is negotiable. Your rates, which can be on a daily basis, which can be on an hourly basis, which can be overtime on holidays, which can be night call, and everything is negotiable. And when you kind of start getting involved with this, you kind of see where people are and what the rates are generally, nationwide. So you kind of get a good idea as to where you're going. The other minus, well, the agency is a middleman, so the clients obviously pay them a commission. There's no fees for us getting involved or signing on. But the client that they have, the hospital, whatever, pays them an additional amount over and above what you're getting paid. But the rates are extremely reasonable as far as I'm concerned. It's actually much better than I ever anticipated, and depends upon what specialty you're in as well. And the other thing is, from Locums, you can actually work solo if you want. Some people decide to just call hospital settings directly and say, look, I'm an individual physician, and if you have any need, I'd like to negotiate with you directly. If you're interested in finding out about me, let's talk. Let's have a meeting. Let's do a Zoom conference, whatever, and try to work around the middlemen. And as a result, you may get better reimbursement rates as a result of that. But everybody's different, of course, in every hospital facility, especially in the time of COVID now, there were budget cuts and people were let go, and now they're starting to call people back. So things have changed quite a bit as a result. So that's just a brief introduction to Locums. I can also say, without any disclosures, that I purchased these books here online through Amazon. Actually, this is one of them, actually, which I kind of started with, which I found very, very informative. And then after that, I got this one here, which is the Road Warrior Physician, which kind of like is a guide to what you need and goes through all the different things that you may find along the way. This one here, these are very inexpensive, actually, the Locums Lifestyle. And these are all written by physicians, actually. And they were very, very informative, very helpful about simple things and ways to proceed forward. And I found it very, very helpful. So those are just some additional resources that people can look into as well. And you can get them online or on Amazon or whatever, which I have no part of whatsoever, but just as some of my references that I use in getting started. So
thank you, Dr. Blum.
I'll stop there.
Thank you. Can you please put that on the chat box, the name of those books, if you don't mind?
Sure.
We want to keep going and get everyone a chance to give us an overview of all the different models. Thank you.
Okay, and Dr. Colton, if you would, I have the honor of introducing you. So please tell us about your experiences with concierge medicine.
Okay, great.
Great experience.
Do we have any of my slides, or let's see? It doesn't really matter. I mean, let me first. I want to say what Martha, just as an aside, as far as the vaccinations go, Martha, I got this horrible email, this text today from one of my friends, former patients, 18 reasons not to get vaccinated. I mean, so there's incredible misinformation going around, and I agree with you, Martha. That's the most important thing that we can do right now for all our patients and friends is get them all vaccinated and try
Amen.
to cut the disinformation. The second thing, and again, as Martha, is I always start my talks with all these things, telling everybody who's out there who's entering a career in medicine to, it's the same as what you said, is to live within your means. You know, no one's going to starve who comes out of medical school, whatever, primary care, whatever you choose to do. But the biggest mistake you can make is live beyond your means, and then you start making decisions in patient care to make more money, and maybe not what's best for the patient, best for you, and you have to put all these pressures on yourself that you don't need to, when in fact being a physician is enough pressure. Just making decisions all day long about people, taking care of them, life and death things. It's hard. There's a lot of, if you take it seriously, if you have a conscience, being a doctor is stressful enough. You don't need to add more stresses. As far as concierge medicine goes, I started practice in 1984 and was in the fee for service in an upscale area. My practice was in Boca Raton, and I did very well at the beginning. Was, you know, just see patients, bill their insurance, call their families, do a good job. You would succeed. But over time, with as the reimbursements fell and the insurance companies got tougher and tougher, and the reimbursements dropped, at least for cognitive services, it became harder and harder to earn the same type of living. And we started to do things in our office, a lot of ancillary services that I always hated because they were profit centers, but never really added to the patient's care. So what happened was, I know Martha has a nice Medicare Advantage population. So that what's happened in medicine is that there's been a kind of a split, particularly in the over 65, which statistically the bulk of your practice will be in people that are older, that the managed care has boomed, and it's really been good for primary care doctors because they get paid a flat amount of money per patient per month to take care of people, and they don't have the pressures of trying to bill for this and bill for that. And it's been very successful. The problem is that you have a large population who wants to stay in regular fee-for-service Medicare, where they have freedom to choose any doctor they want, any hospital they want, any specialist they want. They don't want the restrictions. And so they're staying in fee-for-service, and I don't blame them because it gives you a tremendous amount of freedom. But what's happened is the primary care doctors, because it's a fee-for-service model where the reimbursements are going down, what they did was they see a lot, the incentive is to see as many people you can every 5 minutes, every 8 minutes, meet them, treat them, and street them kind of mentality. So basically what we're dealing with, and I'm going to try to go through this quickly, is we have a huge group of my age people, baby boomers. So all of you who are going into practice right now, you're going to be taking care of baby boomers and older people as your predominant, as a predominant number of visits and patients that you see most of the time. All right, next. Can I control this, or hello? Hello?
No, I got you.
Oh, okay. You got it? Okay. So basically what this says is patients are not satisfied with their doctors, and they're spending hardly any time with the patients. Next. You got it? Okay. So, basically we have this perfect storm of more and more people. It's access to physicians is more challenging. What we talked about before is because you're in such a hurry, you're focusing on sick care and not well care and keeping you well, which is unfortunate. Basically what I remembered was, in my practice before concierge medicine, you're just trying to put out fires all day, and you really weren't focusing on the whole individual and not enough time. All right, next. So, we had, okay, keep going. And as time goes on and the people get older, we have more and sicker patients and less reimbursement for what we do and less time. So what I did back in 2000 when I started this company, I said to myself, people want a doctor that's going to focus on prevention, see them when they're sick, call them back when they want to be called back, be available, be accessible, be on time. They expect it everywhere else in life. They expect it with their doctors. And I thought to myself, people would pay extra for that. And needless, I never, when I started it, I expected maybe it would work for me because I had kind of a wealthy upscale practice. And I didn't realize that it was going to be such a huge success, and that, doctors all over the country would want to do it, and patients all over the country were demanding it. So basically why it's so great is it really takes, it's only for people who can afford it. I mean, the prices people pay can be as low as $1,000 up to, some of these crazy practices are $20,000 per patient per year. It will only work in an upscale area. It probably only works when you've already had an established practice and a reputation. But it takes total pressure away from you as a provider, as a doctor, because now it's almost like in a managed care environment where you're getting your flat amount of money per year per patient. You know at the beginning of the year you're getting paid enough money to pay your staff, to pay your overhead, and to pay yourself. And then you can just focus on taking care of people and keeping them healthy, keeping them happy, impressing them, calling them back, doing everything you possibly need to do to make sure that they sign up the next year, and having enough time to focus on lifestyle prevention, all those things that take time. And people you asked before, do you get, is it hard because people demand, that do they demand all this service from you? Do they call you all the time? Do they want you on vacation? The answer is patients actually respect you and they don't do that. No, the funny part was that knowing that they can get you at any time, just knowing that, they're relaxed and then they don't call you. And the truth is the phone doesn't ring that much because they know if I really need them, the doctor will call me back. It used to be in my old practice, we were afraid they couldn't get in to see me at 9 o'clock in the morning. I'd get 100 phone calls, but that didn't happen anymore because they knew, they felt comfortable that whenever they needed me, I would be there. And they do respect your time. The patients do not bother you for stupid things on, Saturday and so forth. It's very rare. And usually the calls you get are really important. And the truth is the calls you get that are not important, it's great because you say, well, that's an easy one, do this, do that, and you go on with your life. So I think the lifestyle, the advantage of, and I'll try to finish soon, the advantages of concierge medicine are your income is excellent, you have a much better lifestyle because you're not working as frenetically. You still have to take it very seriously and work hard. If you want to do it so you can go out on the golf course every day, don't do it, it won't work. And I think it's because the patients are happier. You can do what you were supposed to do as a doctor. And we all feel a little bit guilty. I mean, I always felt a little bit guilty that I was, only taking care of, I will say people that are, upper middle class or wealthier. But, I decided to settle in Boca Raton, and it's surprising the amount of money that they're spending, $1,500 to $2,500 a year is not, at least in MDVIP, is not a huge number for a lot of people, and it's really a matter of priorities. So, I think it's tremendous value. 95+% of, when I first started, almost every patient signed up. They came back, signed up the next year. I thought I was spectacular. What a great guy, everybody loves me, and no one can do what I did. But what I found out was as the concierge model started and more doctors around the country in MDVIP and outside of MDVIP did this, the patients all signed up year after year after year. So they were very pleased with it. All right, next slide. And then I'm just going to go through this quickly. The physician satisfaction has gone going down over time because of the stresses, the EMRs, the workload. This helped solve that problem. Next. Next, I won't talk about this. We talk about the fees for fee for service are going down, so it puts more pressure on your practice. Next. Patients are dissatisfied a lot with particularly with their fee for service medicine. Next. The retainer practice, remember we started in 2000. The Senate, our Bill Nelson, who was our senator then, tried to pass a law to ban concierge medicine, and it really never got anywhere in the Senate. And now it's, 20 plus years later, and even though it represents a small percentage of doctors, it's clearly here to stay and it's not going away. Next. You're starting out in practice, it's hard to start a retainer concierge practice when you start, because it's really someone that you have a relationship with that you're willing to pay more money for, to pay for every year. So in MDVIP, when we brought new doctors in de novo right out of training, it usually didn't work out. But this for those of you in practice, the status quo is difficult. Next. Again, it all boils down to the physician-patient relationship and what's happening in healthcare with the low reimbursements. They're moving really quickly. They're working on your EMR and working on all these data for all these organizations you belong to, like ACOs and so forth. It's really getting in the way of a good patient-physician relationship, which is really the most important thing when you're practicing primary care. Next, I think I'm done. Next, we won't talk about this. Next, we don't have to talk about that either. Again, what we want is better. Next, what's the studies of the next slide? The physicians are extremely happy. We've studied them in an MDVIP. Next. Patients are very satisfied. Next, the MDVIP has published some articles showing that patients in retainer practices have much lower hospital utilization, much lower readmissions, and better patient satisfaction. Now, again, you could say, you know, that, well, these are wealthier people who take better care of themselves, and, you know, maybe that's a factor. You can say that, but the truth is the data does show that these people do a lot better compared to the regular fee-for-service patients. Next. The discharges, which represents hospitalizations, year after year after year, MDVIP hospitalizations are, you know, 70% lower than the national average age adjusted. Next. And there's different models. You can do a pure concierge model where every patient pays you the fee. You can do, there's models where some patients pay the fee. I think the mixed models are bad. They stink because, I mean, the answer is if people are paying you money, they want you to be available. You want to be available, accessible. You want to have a small practice so you can spend more time with them. If you have some patients that pay and some patients that don't pay, it's, you know, there's a conflict of interest there, and I don't think you can really provide the level of service. But that's my bias. Next. That's it. You know, basically, you know, it's a decision you all have to make. I'm really proud of the fact that model has done so well, and so many people and so many doctors are happy. You know, I bump into, my last thing I'll say, I bump into physicians all over the country who are in MDVIP now has over 1,000 doctors nationwide. I mean, I'm out of the business. I sold my share 10 years ago, but I bump into doctors all over the country who stop me and tell me, you know, that I changed their life. I changed their patient's life by, you know, starting this program. So I'm very happy it worked out.
Thank you, Dr. Colton. Very informative. You know, it's interesting that we all have different, you know, ways to solve problems, and I think that that's probably the most important thing to learn today. John, do you have the Dr. Mason's video?
Yes, I'm going to go ahead and try to play it now.
Okay, this is John James. If you haven't met him, he's head of HERC, and he's head of our safety issues. So he works with a lot of the public health issues, and especially disaster management. So John has been with the Medical Society for many years and has been very instrumental. And if you ever have, you know, a true emergency, John is the first guy that's out there to save us. So thank you for all you do.
Yes, thank you, John.
Thanks, Shawn.
Thank you. Hopefully this will work. Okay.
Hi there, my name is Claudia Mason, and I am an employed physician. I've been with the Cleveland Clinic for 13 years. Prior to that, I was with Presbyterian Healthcare in New Mexico and was a medical director for one of their hospitals. I'd like to talk to you today a little bit about what it is to be an employed physician and the various ways that you can be employed and the pros and cons. Organized medicine is your advocate as a physician, and as an employed physician, it is very important that you support organized medicine because they are your advocates. The AMA has principles for employment of physicians that helps break the conundrum of patient versus pocket and helps you keep your patients first. So as a practice model, employment is trending. It gives you tremendous facility of entry into a position and exit. There is financial security of getting a paycheck on a regular basis and knowing what that's going to be. A large range of benefits, especially if you are employed by a large organization. Overhead and human resources are not your problem. Malpractice is not a problem for you. It is included, as is your practice coverage if you are away. However, to choose something, you will need advice. Most physicians will employ an attorney to look at contracts. You will need to check references on the practice and the organization. And some people will get an MBA to be able to assess an employment position or a practice opportunity. Academia is a very familiar institution for employment. It's familiar to new graduates as they've just come from an academic setting. It's very intellectually rewarding, keeps people on their toes. There is travel involved when you're asked to give presentations, and there is a fair amount of prestige as you are looked to as the authority. Cons of academia include compensation is usually lower than it is in the private sector. There are always politics in academics. There are always people vying for different assignments, opportunities, etc. Additional work such as committee meetings and tutoring are not compensated. And there is the academic pressure to publish or perish or to produce. Then there's private practice employment. Private practice may be by a single individual, by a multi-specialty or single specialty group, or it may be through a private equity arrangement that has purchased medical practices, or by a practice management group. The pros are usually this is all about money, and there's higher compensation and more practice efficiencies to reduce overhead. Opportunity for ancillary income may be available to you either through additional production, maybe due to utilization of various equipment or procedures that are cash only. Opportunity for increased rewards are usually tied to production, and you have to be very careful because it's all in the contract. Cons of private practice employment include ethical challenges, the pocket versus patient dilemma, what's good for your patient, what's good for your pocket, the pressures that you may feel. There may be some debt, overhead, or liability expense that you must overcome prior to getting any bonus, and that needs to be very well understood. There is some downside risk due to economic circumstances of reduced compensation or termination. We saw this during COVID. Communication and personalities of the managing partners are probably only something you're going to find out through checking references. Restrictive covenants are almost always included so that you cannot just build a practice and move next door if you decide to move out. Then there is practice by a hospital or a hospital system. There's financial security, benefits if the hospital has a large number or hospital system has a large number of employees. There may be additional compensation and benefits for medical staff versus regular employees. Opportunity for advancement as organizations tend to have layers of supervision and management. Equipment and technology in hospital systems is something that is regularly renovated when equipment becomes obsolete or becomes worn. There is revenue set aside to replace it. It is not an emergency. There's usually a team environment for working. You may work together with physicians, APPs, ancillary staff, nursing staff, and office support staff to manage your patient load. And there's usually a set work environment of hours, locations, and expectations that you'll be on site. downsides of hospital or hospital system employment. Compensation is usually fixed. There's usually a contract with a fixed amount of time on it. There is some risk of stagnation if you are doing the same thing over and over and not a lot of ability for you to expand your reach. Some people have the feeling that they are a cog in a big organization and are sort of forgotten. Benefits may be reduced due to economic downturn. We also saw that during COVID. And the biggest complaint is usually lack of autonomy in being able to make day-to-day decisions about how the practice is run. Additional opportunities for employment include, obviously, public health opportunities, VA. Government agencies, state and local, may have clinical or non-clinical positions available. Medical device companies, pharma, insurance companies, or what we call going over to the dark side. Consulting work. I've had a consulting business in the past where I consulted on practice startups. Physician executive is a title and frequently will be found as a vice president of medical affairs, a chief medical officer, chief information officer. These are titles for physician executives that can also move up into presidencies or regional management or even national management of large groups. Writing and publishing and being a consultant or having your own publications is certainly an outlet where you can either be employed or become self-employed. And becoming a media physician is another outlet for physicians in this day and age. So there are lots of different opportunities out there, and different stages of your career may fit different practice models. Early career and late career may be ones where you're seeking more security, mid-career where you are inviting more risk and reward. Retirement also offers some opportunities for volunteering, for mentoring, and for teaching, and some clinical work as well as a volunteer. So lots of opportunities. I thank you for your attention and your patience, and hopefully you will find something that works well for you. But remember, you may change opportunities and practice models several times in your career before you call it a day. Thanks.
That was excellent. I really have to say that this has really been a very interesting panel, and I've been very impressed with the quality of everybody's talks. So I want to throw out the first question, which is, and this is the panel, and what would you think is probably the most important thing that you need to think about when you're first getting out of practice? So why don't you start, Bob?
With me? Oh,
Yeah.
Bob. Yeah. So I would say that's such a great question. This is what I always tell people is, you're going to spend so much time as a doctor seeing people, and you spend more time work than maybe at home. So the most important thing is kind of find the situation in a place where you're happy and where you like the way things flow and work, and that you enjoy coming to work and seeing the patients however you do. If you like the business side, great. Do something a bit. If you don't like the business side, then work for somebody else or work on a salary, whatever. Find a situation and a place and a bunch of people that you're going to work with, whether it's a hospital or on your own, whatever, where you're happy and you're enjoying yourself and enjoy coming to work every day. I think that's the most important thing, because everything else you'll all do okay. It'll all flow from there. But if you do something that you really don't like to do because for whatever reason, make money, blah, 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 then you're going to be miserable. And I think it's really about work satisfaction.
How about you, Mike?
I think that's an easy one. By far and away, location. You got to be happy where you're going to live. And especially if you're married or have a family, even more importantly, your wife has to be happy or your husband has to be happy where you're living. Because if you're not happy where you're living, when you're coming home from the office and you dread where you're living, if you like to ski year round, South Florida should not be your place where you're going to move to forever. If you like warm weather, you're not going to move to, to North Dakota or Michigan or Wisconsin, because for 6 months out of the year, the temperature is 32 degrees or less. So you got to be happy regarding where you are geographically. And if that works, everything else from there on in should probably fall into place.
Dr. Rodriguez.
Well, I think if I'm talking about when you get out of residency, now with the young population, I think the biggest issue is technology. There is a world that you can press a button and know anything that you want to know, but there's a lot that you don't know. Stay open-minded. Be careful with thinking that you know everything. Remember that there's always room to know what you don't know. I find the hardest thing to deal with the young population is for them to accept what they don't know and to be open for us to tell them we walked that path. We want to save you from that grief. So my biggest advice, be open-minded and always know that there's a lot that you don't know, no matter what you can Google.
That's excellent. And I think that experience matters. I know that, recently I saw somebody who had a very rare condition and I'd seen it many times before. And I know that I approach it very differently now than I would have before, because I said, okay, it's this. I didn't order a lot of testing. Boom, and there's the answer. And, that would have been one of the conundrums, and, you just have to know when to reach out to know for help. And I know for myself, probably the best way, being the best physician besides caring for your patients and just taking care of them like you would your mom or dad, is just knowing when to ask for help. You don't need to know everything. You just need to know who the guy is that you need to talk to if you can't figure this out. There's nothing wrong with getting help.
I always tell Shawn, I always tell the students, and I'm not going to say the word, the one thing that differs a good physician from a bad physician is to recognize when you're standing on poop. You don't have to know how to fix it or how to clean it, but if you have to recognize when you're standing on poop and ask for help. Nobody expects you to know everything. But if you don't recognize that you're standing on poop, then you've lost the battle.
You got to know your limitations.
Yeah. Mr. Howard.
Yeah, obviously not being a physician and going into practice, I've seen, my brothers do it, and they're happy. They're in positions, like Dr. Colton said, where they like the people that they work with, but they've also merged that with what Dr. Blum said of they like the location where they live and their family is happy there. And it's really hard to find that. I think you have to be willing to maybe move around a couple times until you do it. Don't be scared of that. I'm sure, my father practiced for 30 years in the same location. So it's different now. I think it's okay to try a few things. There's different practice models, as you see. There's different people, personalities, styles, etc. So don't be afraid to find that right fit, because it's going to be a long, long road ahead for you, and you want to enjoy it.
So I'd like to say one other thing. Oh,
yeah, go ahead.
Just quickly is maybe because I'm an entrepreneur as well as a doctor, I go to these doctors, students call me and they want to start this business and that business, and and I get a little nervous, and I think, remember, if you're going to take care of patients, like, it's a privilege, an honor, and it's a privilege to be a doctor, and you have to remember, if you're going to see that taking care of patients, patient care comes first in terms of your work and your job, not maybe when you're home. And don't lose sight of that and start, thinking about this and that. And with all these things we have to do, or that you all have to do, I'm retired, that's more difficult than when I first started. Don't lose sight of that, because that's our primary role as physicians.
Yeah, I agree. It's kind of build them and they will come. I mean, I enjoy going to work every day. I still do. I've been basically in the same place for almost 30 years. And, I work with Ira and Jody. We're probably the two nicest guys around. And, you know, it was the first job I landed right after leaving fellowship, and I'm still there and been a partner forever. And, you know, we just hired 2 new doctors, and, you know, the cycle's continuing, and we're actually, you know, very, you know, clear in terms of there's no hierarchy in terms of the practice. You know, when you're a junior doctor, once you buy in, you get all the goodies like everybody else. We don't, you know, we're trying to keep it as even and level playing field so that, you know, the founding doctors don't, you know, reign above everybody else, even though they're not seeing patients. So, you know, you gotta see patients. You gotta do your work. That's premier, and everything else will fall into place. So, you know, my only other comment is that, and this will go back to what Dr. Rodriguez said, is that you got to live within your means, especially when you start. You know, that shiny new car that you've been wanting forever isn't going to be a shiny new car 5 years from now anyway. And, you know, it's not worth putting yourself in debt over extra stuff. And a lot of stuff is really just stuff. You know, the important things are your family and, you know, your sense of well-being. And the best way of doing that is not to put extra pressure on you that you don't need to have. So I'm going to open this up for questions from the outside. So anybody have questions, either bring in the mic or, you know, you can start with the chat.
Those.
I think you guys did such a good job. Nobody has any questions.
There's one question there that's directed to Bob, actually. It says, Bob, it says, are you aware of a successful MD-VIP specialist practice?
Yeah, I wrote that down, that at least in Boca, because it's, you know, well-to-do, there are some concierge cardiology practices that people pay extra for cardiology, but that's few and far between. You know, that doesn't happen most places. The other specialty where there's a lot of concierge practices is probably pediatrics around the country. There's a lot of, if someone is your primary care provider, let's say it's for a kid is a pediatric, or if you know, and for the woman, if their OBGYN is their primary care provider, it probably works. There are some OBGYN practices, but it's all very tiny compared to primary care. I mean, I would say 98% plus or whatever concierge practices are primary care practices.
Excellent. I'll tell you, you know, primary care has always been the foundation of what we do. And I totally agree that the way the system is coming, and, you know, you're trying to see, you know, everybody kind of fractionating healthcare, that we're losing our base. And it'll be very interesting to see how the future is. But I really think that the value in primary care is immense, because, as you say, you know, most practices, you know, practice, you know, emergency care, and they don't practice preventative care. And, you know, I do ask patients all the time when I see them, you know, are you up to date with your mammograms, and have you seen the dermatologist, and blah, blah, blah. And you'd be surprised at how many people don't, you know, and I think part of it is that the primaries are just so darn busy, and they just never get to it because the patient's always going with complaints. So, you know, I think that, you know, you're right. And I do believe that you know, the concierge practices to a large extent sometimes do reduce hospitalizations, you know, just because they have more time for patients. But, you know, I think anybody can do that. And, you know, and just, you know, we have to really push back. And again, you know, back to the plug for organized medicine is that we really need to make sure that we don't lose our base, because, you know, the state legislature and other people are kind of dumbing down, you know, the entry to practice, where, you know, the mid-levels are now going to try to take over as being primary care doctors, and they're not going to be doctors in you know, supervision, you know, and that's why I think a lot of the young doctors are now going to go right direct to specialties, and they're going to try not to do primary care, you know, so there's going to be even a bigger primary care crunch as we go down, because, you know, they're looking at, you know, how the legislature behaves in terms of, you know, whether or not they'll be supported in the future.
Yeah, I would agree with that. I mean, I think it's back to know what you don't know. And I think there's a big role for PAs and NPs in medicine, especially for management of some chronic diseases, education, so forth. But when you throw them out there on their own and they've had limited, training and so forth, it's pretty scary. And they're going to make mistakes, and there's a lot of roles. There's a lot of places for them. And really, I always say the primary care of the future is going to be teams, with doctors ahead of the team, with nurse educators, nurse practitioners, whatever, working with them. And that works better. And then when you have to ask a question, and, when you're managing stable diabetes, that's great. If something's out of whack, doesn't make sense, you turn to the doctor or the endocrinologist, whatever it is, who has more experience, and that's a much better model. And to give them total independence is kind of stupid.
Yeah, as long as the doctor's ahead of the team and not the MBA.
Right, I got that. I understand that. Yeah.
Because they won't have a doctor. They'll just hire the least experienced and the lowest cost provider. So anybody else have any questions for tonight?
Okay.
Okay, well, I
No,
really
Shawn, I
appreciate.
want to,
Yeah.
honestly, I want to thank you for everything you do and taking the time to do this. And I hope the students appreciate you organizing this and the importance that this has. I really do. Thank you, Shawn.
Oh, it's my pleasure. And again, this is recorded. I mean, a lot of them actually log in later and they are busy and they got families and stuff like that. So this will definitely be viewed by lots of people.
We'll promote it in MedLink on tomorrow.
Yeah, and I really appreciate everybody's help. And good night, everybody. Thanks.
Good night.
Thank you.
Have a good
Thank you,
weekend, all.
everyone.
Thank
Good
you.
night. Thank you. Please
Thanks,
get your
Mindy and
vaccine. Get your vaccine and attend our opioid events, please.
Yeah,
Thank you.
that's a really good event. Thank you. Bye-bye.